Hi, I'm Connie, and I'm going to be playing the role of the OR manager today.
And I'm Maggie, and I'm going to be playing the role of narrator.
And I'm Ginger, and I'm going to be the surgeon.
This scenario recreates an OR manager conversation with a surgeon who has a pattern of breaking the rules and creating a hostile work environment. We know that in the operating room, problems don't come in neat little boxes, but in large, messy bundles that can affect patient safety. The nurses in this OR have expressed concerns about Dr. Jones because of blatant disregard of the rules regarding aseptic technique and performing the timeout. They have also addressed concerns about her explosive behavior creating a hostile work environment. Additionally, her infection rate is high and patient safety is a concern. Unfortunately, in our first scenario, the nurse manager has a preconceived opinion of how the conversation will go. She dreads having to confront Dr. Jones because she has talked with her many times before and has not seen any behavioral changes. The manager wishes the chair of the surgical committee would take care of this problem and remove Dr. Jones of her privileges. She is guarded and accusatory. Watch how this turns out.
Hello, Dr. Jones. Can you come to my office for a few minutes?
Is this going to take long? I'm very busy today.
I know. We're both very busy. I just need a few minutes to talk to you about your infection rate and also some patient safety issues that my nurses brought to my attention.
Okay, we have to do this. I'm sure I've heard this all before, so let's make this quick.
You're right. We have talked about this before, but you have not changed your behavior. There's been a significant increase in your surgical site infection rates in the last 6 months. My nurses tell me that you're not following aseptic technique protocol when you scrub and enter into the room. They say you continually contaminate yourself and yell at them when they point it out and ask you to re-scrub or regown. Also, they're telling me that you're refusing to complete the timeout procedure properly.
Are you questioning my ability to scrub in and do the right procedure? This is ridiculous. I've been doing my job for over 20 years, and I don't need anyone telling me how to do my job.
I don't like to talk to you about this any more than you like to sit here and listen to me. But we have a problem, and I need you to follow the rules and stop yelling at my nurses. I know, you're the leader in the OR though, Dr. Jones, and you have to set the example. The environment that you create because you don't follow the rules puts our patients at risk and the nurses on the defensive. I've asked the nurses to let me know if there are any more breaks in procedures, and I expect that you will follow the rules and not exhibit any unruly behavior in the operating room. If there are any such reports, I'll have to report you to the surgery committee. Do we understand each other?
You know, I'm just so tired of this. Nurses just nitpicking. You know, I'm trying to take care of patients. What do you expect me to do?
Well, I expect you to just follow the rules, Dr. Jones, and if there are any more problems, I'm going to make sure that the surgery committee knows about it.
I'm leaving.
Oh my goodness, it's their mother's fault.
You can see that the first 30 seconds set the tone for the entire conversation. Our overall goal should be to confront with safety to avoid defensiveness. The manager did not help the surgeon know that she cared about her best interest. She did not describe the gap or find mutual purpose. Instead, she led with unhealthy conclusions, accusations, and disrespect. We know that this conversation will be difficult and that the surgeon will get defensive. In this scenario, watch how the manager backs up and recreates respect and safety by using the crucial conversation techniques, starting with the heart, making it safe, creating mutual purpose and mutual respect, contrasting and moving to action to get a positive outcome.
Hi, Dr. Jones. It's nice to see you today.
Hi, it's good to see you.
I haven't seen you in a couple of weeks. Is your daughter ready to go off to USC?
You know, we are so excited, and yes, she is so ready to take this next adventure. and we're so proud of her.
Yeah, you must be really proud of her. Thanks for coming in to spend a few minutes talking to me today. I realize your time is valuable. I just wanted to discuss our quarterly surgical site infection rates and patient safety procedures here in the OR. And I know that you only want the best for your patients and that we can work together as a team to provide that.
I'm sure I've heard this all before, so let's make this quick, please.
Dr. Jones, unfortunately, we've seen a significant increase in surgical site infection rates throughout the hospital in the last 6 months and a decrease in pre-procedure timeout compliance. I'm really concerned that aseptic technique and universal protocol are not being followed in the operating room. The most common times for a breach in aseptic technique to occur happens when scrubbing in and entering in the room and also gowning. And because the surgical team is so busy getting the case started, the timeout isn't being performed. Are you aware of any of these things happening when you're preparing for surgery?
Are you questioning my ability to scrub in and do the right procedure? This is ridiculous. I've been doing my job for over 20 years, and I don't need someone telling me how to do it. Are you sure it's not your nurses?
I realize you've been doing this a really long time, and I respect the work you do. Your job is very stressful. My goal today is not question your abilities, Dr. Jones, and to make you feel defensive. I just want to ensure that we are all providing the best possible care for our patients during surgery as a team. I also want to ensure you that patient safety and aseptic technique involves everyone in the OR, and I want everyone to be accountable. If someone sees a break in procedure and technique, I want them to be treated with respect when they call it out.
I understand.
As a surgeon, you serve as the leader in the operating room and an example for others, and it's easy to get into a habit and not realize it because we're so focused on the other things. Your job is certainly not easy, but it's important to remember how the little things such as proper aseptic technique and performing the timeout can make a big impact on our patient outcome. Wouldn't you agree?
You know, I believe you're right. You know, we all need reminders at times, and I really appreciate that we're able to sit down and have this conversation, because the last thing I want is for my patient to get an infection, and heaven forbid, I do not want to do a wrong procedure.
Yeah. Your experience level speaks volumes, and I'm passing this information to everyone who's a part of the surgery team. We're all human and subject to human error at times, and if anyone notices a breach in aseptic technique, it's their duty to speak up and become an advocate for that patient. In other words, if you notice a break in technique or procedure, it's your duty to ask the nurse to change gloves or scrub longer, etc., and vice versa. If we are responsible for ensuring the patient safety in the OR, wouldn't you agree to this type of responsibility?
Well, you know, I already hold myself accountable. I don't know that I have time to make sure everybody else is doing their job right.
I understand. The fact of the matter is, though, that aseptic technique and the universal protocol is everyone's responsibility. Our patients count on us. The surgical site infection rates have reflected that we have to be diligent. We are all responsible and need to work together as a team. The OR staff has been instructed to report any breaches in protocol and also to speak up when they witness a break in the aseptic technique or the timeout procedure, so that the problem can be reconciled then and there. This will decrease patient risk for infection and ensure patient safety. Are you willing to work with the staff in helping reduce our surgical site infection rate and ensure patient safety?
I suppose I can be more attentive to myself and others. I don't mean to cause any harm to any patient, especially, and create an environment where a nurse doesn't feel comfortable speaking up. I appreciate you taking the time and sharing with me about the infection rates.
I'm glad we've had an opportunity to talk today and that we can agree to work together as a team, Dr. Jones. Thank you for meeting with me. I appreciate your time and consideration on this important matter. Hopefully, by working together, we'll see a downward trend in surgical site infections throughout the hospital. Have a wonderful day, Dr. Jones, and would you please keep me updated as to how your daughter's adventures are doing?
Thank you.
Okay, bye-bye now.
In this tough scenario, the manager was able to build safety. She first maintained mutual purpose by discussing patient safety, a concern she knows is important to the surgeon. She then uses contrasting to maintain mutual purpose and respect when the surgeon feels offended. She then created a new mutual purpose that involved more teamwork on the surgeon's behalf, that of accountability in the OR. These communication strategies show how to turn a bad scenario into a successful, crucial conversation. Thanks for watching.